Hey everyone, I'm Rachel. Today we're going to talk about things to look out for during pregnancy to try to avoid diastasis recti, or DR, which is the separation of your rectus abdominis. And it's super common, but we want to try to avoid the severity of it while we're pregnant, if we can. Okay, so the first thing to look out for is coning. Coning is a sign that you have way too much pressure on your abs, and we want to make sure we avoid any extra pressure that we don't need. So avoiding sit-ups and crunches is very important, or any conventional ab exercise where you're on your back. Once you get to your second trimester, avoid those. Another thing we want to look out for when it comes to coning are exercises where we're face down towards the floor. So planks may cause coning. If you do see that bulge, stop that plank. You can try on your a plank on a chair for less impact, but you may still see that bulge, in which case you should just avoid planks altogether. Another thing really depends on the woman is being in the quadruped position. So a quadruped position is when you're on all fours, on your hands and your knees. And if you do see that bulge, again, stop. You're putting too much pressure on those abs. So we want to make sure we're safe rather than sorry. So even if you're not doing ab work when you're on all fours, maybe you're doing some glutes, or maybe you're just on all fours for another reason in your life. We want to make sure that we're really maintaining that belly and making sure to avoid the coning. We also want to be aware of how we're getting out of bed and how we're getting up from off the floor, just coming out of that lying down position. So I'm going to demonstrate for you, maybe not very gracefully, so apologies. All right, so starting from a lying down position here, we're going to roll to our side, keeping your knees bent, and then get up using those arms. That's going to help keeping our stomach engaged. We're going to avoid using those tummy muscles. Instead, we're using our upper body to get up off the floor. The last thing I want to talk about is belly breathing, which is working our transverse abdominis, which is really deep muscles in those abs. So when you inhale through your nose, I want you to think about inhaling all of the air, and then when you exhale, I want you to bring your diaphragm up and almost think about bringing your baby in and around your belly. So your belly should you can almost see it come in as you exhale. So let's do a few together. We're going to inhale through our nose, real big deep breath. And then exhale as you bring that diaphragm in. I'm going to go to the side so you can see. Inhale through your nose. Exhale, bring that baby in. Inhale. Exhale. Inhale. And exhale. So keep all of these tips in mind: avoiding coning, belly breathing. We want to make sure we're safely getting off the floor to hopefully prevent or at least decrease the severity of DR postpartum. If this was helpful for you, please drop me a comment below. I'd love to hear from you. And make sure you subscribe to my channel and click that little bell next to the subscribe button so you get notifications every time there's new content. I'll see you next time.